It's a question without an easy answer, and it's not new, says Scripps Chief Medical Officer for Acute Care, Dr. Ghazala Sharif.
We had the same thing happen when the tiers were open up to age 65 and up. We had just at Scripps alone over 200,000 patients that qualified age 65 and up, and initially we only had 10,000 vaccines.
That same situation could very well happen again in the coming weeks, and it's likely to be worse. By the middle of March, hundreds of thousands more people in the county will become eligible to get the vaccine. Governor Newsom says as of March 1st, teachers, law enforcement, food service, and agricultural workers will become eligible. Then, on March 15th, another enormous group of people, those aged 16 to 64 with certain pre-existing health conditions, will be able to get a shot. Dr. Sharif says the county, along with healthcare systems, are doing their best to distribute and administer vaccines. But she says they could do much better if only they knew how much they were going to get.
We will find out today what we are getting on Monday or Tuesday. So we can plan as much as we like for next week, but if the vaccine doesn't come in, we just don't know what else to do.
There is promising news when it comes to supply. Pfizer says it will be able to deliver 13 million doses per week across the country within the coming weeks, and Moderna says it will be able to provide 40 million doses per month by April. But Dr. Sharif says once people with underlying conditions become eligible next month, the floodgates are likely to open, and doctors will be put in the difficult position of deciding whose underlying conditions will make them eligible and whose won't. Still, on KPBS Midday Edition Thursday, Assistant Medical Director of Family Health Centers, Dr. Christian Ramers, said there is some hopeful news, especially when it comes to making sure vaccines are given in an equitable manner.
There's a federal program that is going to ship vaccines directly to community health centers. We haven't seen a dose arrive yet, but we're encouraged by the fact that those will be coming again soon.
Plus, it appears the Johnson & Johnson vaccine will get FDA approval within the next few days. Good news, not so good news, just part of what makes this era of COVID so tumultuous. John Carroll, KPBS News.